welcome. You're watching Medically Speaking. I am Meenakshi Upreti. Joining me is Dr. Ravi Shekhar Jha. He's the Additional Director of Pulmonology at Fortis, Faridabad. Thank you, sir, for joining us on NewsX. I'm sure you know that as of now, there's a lot of curiosity, a lot of questions around the new variant of COVID, which the World Health Organization has flagged. They say they're looking into it. Give us a little more about what we know far as this new variant is concerned. Do we need to be worried right away? Because I'm sure you know that the attitude of the people has also become rather lackadaisical towards COVID.
So the new variant that has recently been detected is, along with India, it has been found in around 11 more countries, and it is said to be highly contagious. The fatality, the mortality rate, the risk potential is not yet known, but what we can see at this moment is it is strictly contagious variant, and it has the potential to affect whole family in one single day. So we need to be very careful because we know that this is a mutated variant, and mutated variant can turn into fatal anytime.
Right. It is a mutated variant, sir, and there is not much known about it. But talking really about the various variants of Omicron, what are the variants which are as of now present and prevalent in India? And what do we need to know about them? Because the general thinking, and I speak from a layman's point of view, amidst the people seems to be that Omicron, not that dangerous, nothing like the Delta variant. So we can, of course, go back to our daily lives without much caution.
No, so we have already seen the dangers of taking it lightly in second wave. This Omicron variant, basically, it has also the potential to mutate. It is mutated into various subtypes. The subtype that is present in United States of America and few other countries, BA.4 and 0.5, but the subtype that has now started gaining very importance in India is BA-2.75, which is very, very contagious. Now, the point is that any variant like Omicron variant, if it mutates into a dangerous variant, and if it is contagious also, that can cripple whole country. So fortunately, the data that we have so far is that it is contagious, but not that fatal. But then, of course, for the last 2-3 days, I've started noticing increase in mortality rate in India. I've also started a slight increase in mortality rate in few other European countries where the BA-2.75 variant is predominant.
Right. So the fatalities, there is a slight increase. Of course, there are a lot of modifications of the virus as well. It also adapts with time. Where does science stand? Where does the medical fraternity stand as far as the cure of COVID is concerned? That panacea still awaits us, sir, isn't it?
One thing the scientist and medical fraternity is very sure about is that there's one thing which can give you almost sure-shot protection against deadly complication is the vaccination. The problem with India is that majority of people are still not booster vaccinated. People think that booster is not important, but the science has shown us that a few of the Western countries have shown us that booster dose is very important. And if we do not take booster dose, immunity has the potential of getting weaned easily. Just yesterday or 2-3 days back, our policy makers have reduced the timing of booster dosing also from 9 months to 6 months. So I think that is the one thing which can easily protect us from getting into fatal complications.
Right, and that really is a way to protect ourselves from fatal complications. You since speak of the booster doses, they're available from quite some time, but the government says that the people are not going ahead and taking it as proactively as they were the first 2 vaccine doses. The government has also reduced the timeline from 9 to 6 months. First, what do you think of the move? And second, what would you like to tell those watching the broadcast?
The first thing is that we must not be very casual. Like I can see if you go to the malls or any other places, you can see people are, they kind of gather in crowds and they do not wear masks. They have completely stopped following COVID protocol. Now, since the new variant is on rise, we must follow the COVID appropriate behavior. We must follow all the protocols that are in place. If it is mandatory that we cannot avoid going out, then only we should go out. Otherwise, we should totally avoid going to the picture halls and other crowded places like the marriage function. Other function also should be there should be limited number of guests. We should not invite everyone. There should not be too much crowding at any place. That is one thing we must follow. Plus, we must encourage our RWA to promote for booster dose vaccination.
Right. Promotion of booster dose vaccination, absolutely vital. So, as a pulmonologist yourself, what is the impact of the new variant which you are seeing? Of course, the Delta variant was a very difficult time for all of us, but the hospital admissions, where do they stand as of now? What's your personal experience like this time around?
I have not seen any admission because of any respiratory complication, although it has happened that patient had come for some other problem, like the patient presented with for some other complication, and routine screening he was found to be COVID positive. That is different thing, but otherwise, so far in my region, I have not seen any patient who had COVID and presented with respiratory failure, any other major respiratory complication. I remember there was one patient who had history of, bypass surgery, and then he developed COVID. He developed pneumonia also, but then we managed the patient at home only. He had developed mild respiratory failure as well, but then patient was easily managed at home. So basically, if the patient develops any complication also from Omicron variant, it is easily be manageable. But then again, the newer variant BA-2.75, we are not very sure about how fatal it can be, how dangerous it can be.
Right, and that's something which is still in the unknown territory, and that's why perhaps we need to be more cautious. Take us through really, how this new variant is different from the other variants which we have seen, and the steady rise in the number of COVID cases which we are seeing in our country, because that's something about which awareness also is a must.
So the new variant is, if I come into contagiousness, the new variant is strongly contagious. As far as symptoms are concerned, the major symptom of new variant is severe headache, severe body ache, and fever may not be very high, but fever is there. Nasal stuffiness persists for very long. In majority of patients, I've seen that the symptom persists for around 7 to 10 days, but mostly they become non-contagious at 11th day. But otherwise, generally, it is strongly contagious and symptoms are slightly different from the conventional Omicron variant, because we had seen Omicron variant patients had a lot of GI symptoms. They had a lot of gastritis and loose motion and nausea. These variant presently majorly with headache and fever.
Right. So headache and fever are perhaps the most significant and most telling manifestations of the latest variants. But when we talk about, the latest Omicron variant, how effective is the vaccination and the booster dose against the same? Because as I said earlier, the numbers dwindling, people seem rather skeptical. Either it could be skepticism or it could be just a laid back attitude when it does come to taking that third booster dose, which the government has now made available.
See, one we must be very careful about is that booster does not, or any vaccine does not prevent us from getting any infections. So, rising number to do with vaccination. Only thing is that if everyone is vaccinated, the vaccine can prevent us from going into severe complication. That is probably one of the reasons that we have not seen any major complication despite getting so many infections. That is the reason I always encourage people to get vaccinated, normal as well as booster dose vaccination.
Right. The time has come to get ourselves vaccinated, sir, but there are a few sort of misgivings as far as the booster dose is concerned, and let's dispel them one by one quickly. First of all, being those who are affected with COVID. Once someone does recover from the Omicron variant, which of course many of us have unfortunately managed to catch it at least once, what should be the gap between taking the next booster dose? Because there's a slight confusion about the same.
So various countries have come up with various guidelines about the gap, but ideally speaking, 3 to 6 months of gap is sufficient. I mean, once you have 3 to 6 months, you should get your that holds true with normal vaccine also, because once we have taken second dose of vaccine, the gap between second dose and booster should be 6 months. Similarly, if you get a natural infection, you develop some antibody, then the gap between next dose should be 3 to 6 months only.
Right. So 3 to 6 months should be the gap between the recovery from COVID. One more question, sir. Since, of course, you are a pulmonology expert, you say that the impact the Omicron variant is having on the lungs is rather low. But what about the comorbid? Because the example which you gave of the patient who did land up in the hospital, who had a comorbid situation, which is what got you all alarmed, tell us a little more about comorbidity, respiratory diseases, and of course, the latest variant.
So even with comorbid people who are completely vaccinated, I have not seen any major complication. I had seen many people who were obese, who had uncontrolled diabetes, but still their symptoms are self-resolving. There were patients who had severe asthma, who had severe respiratory problem. Again, they developed COVID, but their symptoms are very, very mild. So, but one thing I had seen that almost every one of them was vaccinated. The one patient which I'm talking about who developed respiratory failure also was vaccinated. But then overall, if you see out of 100 patients, rarely one or less than one gets to complication. Even if the person has kind of comorbidity, although he's at higher risk of getting into complication, but I have not seen any major complication in this Omicron variant.
All right, that seems to be silver lining there, but certainly as we sign off, we'd like to tell our viewers that you shouldn't go by the silver lining. Nobody knows what really lies on the other side. There are many who are comorbid, and there is a possibility of you, even if it's a 1 in 1,000 of developing, of course, a more severe disease, of getting more severely affected with the Omicron variant, with the new variant lurking. The World Health Organization ringing the alarm bells. Perhaps it's time to mask up, to try and avoid crowded places as much as you can, of course, as the learned doctor does advise us on the panel here on NewsX. For now, sir, thank you for joining us and speaking to us.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.